Good morning. Myself, I am Dr. Sanjeev Matthew George. I'll be talking about injectable drugs as it is a practical oriented topic. Metronidazole. It is a nitroimidazole derivative effective against most anaerobic bacteria and several protozoas. Pharmacokinetics. Metronidazole is available in IV and topical forms, and in oral forms also it is available. Metabolized in liver, and metabolites are excreted mainly in urine. The adverse effects of metronidazole is mainly anorexia, nausea, metabolic taste, and dry mouth. And it can also cause allergic reaction, skin rashes, urticaria, and flushing. And uses of metronidazole is used in amoebiasis, trichomonas vaginitis. Now coming to penicillin, it is discovered by Alexander Fleming. Mechanism of action: it is a beta-lactam antibiotic which produces bactericidal effect by inhibiting cell wall synthesis in susceptible bacteria. Coming to pharmacokinetics, orally administered penicillin G is destroyed by gastric acid. Hence, penicillin G is usually given by IV routes only. It poorly crosses blood-brain barrier. Penicillin is excreted in urine mainly by active tubular secretions. Coming to the adverse reactions, it causes hypersensitivity reactions such as skin rashes, urticaria, fever, dermatitis, joint pain, and serum sickness. Next group of drug is atropine. Atropine is the prototype drug and chief alkaloid of belladonna. Mechanism of action: it decreased secretion of exocrine glands. In GIT, it decreased motility of the gut and relieves spasm. And in central nervous system, it controls tremor and rigidity of Parkinsonism. In cardiovascular system, it causes tachycardia. Eyes, it causes passive mydriasis, loss of light reflex, and cyclopegia. Respiratory system, it causes relaxes smooth muscle but dries up all secretion. And in urinary tract, it causes decreased tone of detrusor muscle and increased tone of trigone and sphincter. So in at Coming to pharmacokinetics, it is well absorbed from conjunctiva and GI tract and widely distributed all over the body and crosses blood-brain barrier. Partly metabolized in liver and partly excreted in unchanged in urine. And coming to the uses, it acts as a mydriatic agent and used in COPD and bronchial asthma. It acts as an antispasmodic and used in OP poisoning and in Parkinsonism. Adverse effects: in GIT, it causes dryness of mouth and throat, and in eye, it causes photophobia and blurring of vision. In urinary tract, there is difficulty in maturation and urinary retention. In CNS, it causes restlessness in large doses and excitement and delirium. In CVS, it causes tachycardia, palpitation, and hypotension. The antidote used for severe atropine poisoning is physostigmine. Coming to dopamine. Dopamine, it is a catecholamine and metabolic precursor of noradrenaline. Pharmacological action: acts on alpha 1, alpha 2, beta 1 and D1 agonist with noradrenaline release. At low doses, it selectively dilates renal coronary blood vessels by acting on D1 receptor. At moderate doses, dopamine stimulates beta-1 receptors of the heart and increases myocardial contractility and cardiac output. At high doses, it stimulates vascular alpha-adrenergic receptors and causes generalized vasoconstriction. Coming to the adverse effects, it causes nausea, vomiting, headache, hypertension, and tachycardia. And its uses are: it used in cardiogenic and septic shock, severe heart failure with renal impairment. Aminophylline. Mechanism of action: these inhibits phosphodiesterase, increases cyclic AMP causing bronchodilation, improves mucociliary clearance in respiratory passage. Pharmacokinetics, well absorbed after oral and parenteral administration. Adverse effects are tachycardia, palpitation, and hypotension. Salbutamol. It is a selective beta-2 agonist, produces bronchodilation within 5 minutes of action and lasts for about 2 to 4 hours. The adverse effects are palpitation, restlessness, ankle edema, throat irritation, and the uses are COPD and bronchial asthma. Streptomycin. It is the first aminoglycoside antibiotic obtained from Streptomyces. It covers aerobic gram-negative bacilli and mainly used for plague, subacute bacterial endocarditis, and tuberculosis. The adverse effects are vestibular disturbances, not used in pregnancy due to fetal ototoxicity. Coming to heparin. Heparin was discovered by a medical student named McLean. The mechanism of action: heparin binds and forms a complex with plasma antithrombin 3. It inhibits the conversion of prothrombin to thrombin. Pharmacokinetics: given parenterally as IV or subcutaneously. Requires APTT monitoring. The adverse effects of heparin are bleeding and heparin-induced thrombocytopenia, hypersensitivity reaction, osteoporosis. And the antagonist used for heparin toxicity is protamine sulfate. Coming to cefotaxime, it is a third generation cephalosporin. Both gram negative and gram positive is covered. The T half is about approximately 1 hour, and the uses is meningitis caused by gram negative, hospital acquired infection, and septicemia. Next group of drug is ceftriaxone. It is a cephalosporin. The T half is about 8 hours. It has good penetration into CSF and the elimination is in urine and by bile. And the uses are, it is primarily used in typhoid fever, complicated urinary tract infection, abdominal sepsis, septicemia, and the adverse effect is hemolysis and bleeding. Coming to human MIXTARD, it is an injectable insulin. It contains two insulin groups, that is insulin isophane and soluble insulin. It is a combination of two insulin preparation. One is long acting and another one is short acting. And the side effects are mainly it causes hypoglycemia, weight gain, and injection site reaction also. And it is mainly used to control blood sugars and for correction of hyperkalemia. Thank you all, and this is a short class about injectable drugs. Next we have a class on oral drugs taken by Dr. Vivek. Thank you.